So from a resource standpoint, I think there's a lot of different pieces to the collaborative practice opportunity that they may need to get some help and assistance on. So if it's just on actually developing a collaborative practice agreement or developing protocols, there are some examples out there in the literature that might be a good starting point. Some of the state associations have done a good job of gathering some of those materials, so that might be a good place to start. If you're looking for protocols, particularly clinical protocols, I think colleges of pharmacy and the faculty there can be a great resource. Some of the associations, once again, may have some of those materials, or you may build those on your own, just understanding the current treatment guidelines and working one-on-one with the providers to come up with what you agree on. But those could be good starting points for the clinical side and the actual collaborative practice agreement. If they feel like they need just to enhance their clinical knowledge, I think there's some really good CE programs that are out there that they should focus on particular disease states. And my recommendation would be to focus on chronic disease, the diabetes, hypertension, lipid management. Those are areas right now where all the quality metrics are focused. Heart failure is another one. Asthma COPD is going to be another one that you'll start seeing some more information on. So those would be some areas that if you can enhance your knowledge, do so. The last piece that I think is important is just the confidence and the communication piece, and some of that you got to be born with it, but you can work on that. And part of it's giving a pitch of what you can bring to the practice. Part of it is just being able to communicate with those providers and not be intimidated. And so there's some various resources. There's a great article written by Randy McDonough that's in Journal American Pharmacy Association on how do you build trust with a physician. I think that's a great resource, a good document that I would put in your recommended reading.